Story 1. I have schizophrenia. I told the psychiatrist in the psychiatric ward that I felt like I needed to drain all the blood out of my body so I could get back to the right timeline. I truly believed it at the time. Story 2. About 8 years ago, I started seeing small amounts of blood when I wiped. At first, I thought I was just wiping too hard, but it persisted for a couple of weeks. Then one day, it hurt when I sat down. A few hours after the onset of the pain, it became unbearable. I felt intense throbbing pain near my rectum, and then it popped open, spilling blood and pus all over my underwear. I visited my general practitioner and described what happened, which was quite embarrassing. He took a quick look and advised me to see a rectal surgeon as soon as possible. I went to the surgeon, who made me lie down on a table and spread my cheeks. He told me I had a perianal abscess and needed surgery immediately. The next day, I went to the hospital and underwent surgery. I was informed that the abscess was severe and would likely heal into a fistula, which is essentially a second tube connecting my rectum to the outside. 3 weeks later, I returned to the hospital for a second surgery. Due to the fistula, I needed a seton, which is a surgical thread looped through the fistula and my anus. This was meant to slowly cut away at the muscle between the fistula and rectum. Cutting the muscle all at once could lead to permanent incontinence. For the next couple of months, I had to visit this surgeon every 2 weeks for him to tighten the thread on my anus, gradually cutting the muscle so it could repair itself properly. It was extremely painful. Eventually, the tissue between the fistula became thin enough, allowing for a third surgery to completely cut through and repair everything. Throughout the 3 to 4 month process, I had to wear feminine pads in my underwear to catch the leaking blood, pus, and waste. It became routine to spread my cheeks for this doctor to tighten the cinch around my anus, and the smell was quite unpleasant. It was a challenging time. The only lasting effect is that I can no longer pass gas silently. Story 3. I had a rash that extended from my labia and around my but into my tailbone. It resembled a thong rash and was absolutely awful. Everyone assumed it was a sexually transmitted disease. Then I had to explain that I hadn't had sex in 8 years. Finally, my fourth doctor examined it and said that herpes doesn't spread up your back. This looks like shingles. It turned out I had a severe case of shingles in an uncommon location. I was hospitalized for a different issue a month later and had to embarrassingly explain my shingles to a room full of doctors and medical students. Story 4. I drink 5 drinks a day, and I don't know how to stop. Well, technically I do know, but I'm afraid I will experience withdrawal symptoms. I am experiencing withdrawal symptoms. I have been sober for 152 days. Story 5. I was hospitalized this week for 5 days, and they had me on a cardiac monitor during my stay. The doctor came in on the 3rd morning and told me I had a spike in my heart rate at about 10:30 p.m. the night before. Was I asleep or awake? Awake, I told him, hoping there wouldn't be a follow-up question. What was I doing? Do I remember? I was receiving an incredibly spicy goodnight text from my husband. Thankfully, the doctor laughed and was less worried, but that was an awkward start to the day. Story 6. Freshman year of high school, during class, I was bored and playing with a soda bottle. I decided to see if I could fit the whole thing in my mouth. I could. Triumphantly successful, I removed the bottle and went to close my jaw, but it wouldn't close. Panicked. My mouth was stuck open and a little crooked, so I had to yell out to get the attention of my teacher and classmate. I couldn't talk. My mouth was open wide enough to prevent my lips from touching. We went to the office, but the nurse had no idea what to do. She called the district nurse, who also had no idea. My dad rushed me to the hospital, and while we sat in the waiting room, I managed my spit with paper towels because I couldn't swallow either. The people at the hospital called a dentist, and nobody had any idea how to solve it. I sat there with my mouth agape for nearly 3 hours. They eventually decided to give me intravenous pain medication and then force my jaw back into place. As they were prepping the 4, my jaw miraculously shifted back into place. They sent me home with a sports drink and some ibuprofen. Having to mime my way through explaining that I got myself into this situation by trying to fit a soda bottle in my mouth was horrific. I had to repeat this story for my teacher, the nurse, my dad, and the hospital staff. It was very hard to live that one down, and I still yawn with my mouth closed a lot of the time these days. Story 7. This was in an ambulance, so it was not like I was at a doctor's office. It was when I attempted suicide when I was younger, and I had to admit after being asked several times if I had taken anything. She opened up and said, "I really do not want you to suddenly become unconscious or pass away because you haven't told me." It made me want to be honest, and it was very hard to admit. Honestly, I felt ashamed, but I am so glad I did. Thank you for all the beautiful responses, and a big hug to those who are struggling as well. You have certainly brightened my day, week, and month. I have never received such a response online, and I appreciate it. Much love. Story 8. I have been dealing with a lot of anxiety this past year. I have depression and anxiety disorder, but I have not been taking medication for years. One night, I hyped myself up in a really bad way and could not calm down. My anxiety convinced me I was having a heart attack, and I called an ambulance. It was embarrassing because a small part of my brain knew it was not true, but it felt like I had no control over my body. Two very nice emergency medical technicians arrived at my apartment, helped me calm down, and listened to me for a bit. I felt guilty and embarrassed, thinking that maybe someone really needed help and I was holding up the ambulance for nothing. However, they reassured me not to worry about other people, stating that everyone is taken care of. Sadly, I cannot afford therapy, but I managed to apply for 20 free therapy sessions at the local hospital. I actually started this week, so I hope this will prevent similar situations in the future. Thank you so much, everyone, for your kind words. You have no idea how much they mean to me. Story 9. At the emergency room, I had to admit that I ate an entire bottle of gummy vitamins. It was a foolish decision. I was under the influence. Story 10. Not me, but does anyone remember the story about the guy in Australia who was bitten on 2 separate occasions, about a year apart, by a redback spider on his penis? Can you imagine having to tell the doctor, "Yeah, mate, spider bite on the Todger again?" Story 11. I had a fistula from my bladder into my vaginal canal that was so severe that I didn't urinate from my urethra for 2 years. The doctor did not believe me because I was a teenager, and they assumed I didn't understand my anatomy. I explained that I could hold a cup and isolate my vagina from my urethra to urinate, but they still didn't believe me. After an examination, they finally believed me, and I received treatments that worked. It was such a strange shock to finally feel that I was urinating from my urethra again. Story 12. I had a mini vibrator stuck in my vagina while on vacation and had to go to the emergency room for a foreign body removal because it was vibrating inside me. Story 13. I had to admit to a physical therapist that the reason my lower back had seized up again, making it so I couldn't even bend to tie my shoes, was that my husband and I had tried a new position. We have not attempted it since. Story 14. I fainted once in college because a person I dated tried to hurt me. I passed out and urinated on his bed. I learned what a vasovagal response was when I went back home to see my small-town general practitioner and had to explain this to him. Always be truthful with medical professionals, even if it's embarrassing and they know your family. Story 15. I had a relationship with a medical student while I was at university. One afternoon, when we were in bed, she suddenly got up, grabbed her pen light, and disappeared under the covers. A few moments later, she diagnosed me with a hydrocele around one of my testicles. The diagnosis involves placing a light against the testicle. A hydrocele is a sac of fluid surrounding the testicle, and because the fluid allows light to pass through, the entire scrotum is illuminated. This wasn't particularly embarrassing, but visiting the University Medical Center and having the general practitioner confirm the diagnosis in order to be referred for surgery was embarrassing. Story 16. On the first day of college, I learned what a migraine was. Unfortunately, it was also my first year experiencing burnout. Let's say I was a little liberal with drug use. When asked at the nurse's office which substances I had used in the last 48 hours, I opted to say I had not taken heroin, I think. Story 17. To provide some context, I was 18, a freshman in college, and at the time, I had undiagnosed attention deficit hyperactivity disorder. It was the first time I was living away from my parents and making my own doctor's appointments. I was experiencing some abdominal pain and discomfort. I had recently finished my menstrual cycle and realized I had no memory of removing my last tampon. I convinced myself that I was experiencing toxic shock syndrome and became worried that I might die. I quickly made an appointment with student health and explained everything to the nurse practitioner. They performed an exam and found that I only had a mild yeast infection. I had not forgotten a tampon, and I was not experiencing any symptoms associated with toxic shock syndrome. I was fine. Story 18. When I was 19, I tore the bridge of my foreskin during a drunken one-night stand. I ended up getting a circumcision. Explaining to my mom why I needed to see a doctor immediately was more embarrassing than telling my doctor. Story 19. I had to tell the doctor about seeing, smelling, feeling, hearing, or tasting random things that weren't actually there. I mentioned it lightly because my husband suggested I ask her about it. Schizophrenia. Story 20. When I was at summer camp, I developed a terrible stomach ache after licking a girl's foot on a dare. Turns out she had just cleaned the bathroom floor beforehand, so I ingested cleaning solution. I went to the camp nurse, who told me I was foolish and to return only if my condition worsened. Story 21. When I gave birth to my son, I pushed when I was told not to. The doctor was making a small incision at the time, so I ended up needing 32 stitches inside and outside. After a few follow-up appointments, I had to tell the obstetrician that when I fart, it now goes forward, bubbling to my vagina. Yes, this happened. Story 22. I called the doctor's office, but they couldn't get me in. I told the receptionist that I had diarrhea for 6 days, and they said they would try to get me in after all. Story 23. I went to see my doctor for a severe stomach bug, probably norovirus. I couldn't figure out how I got it since no one else in my group at the bachelorette party got sick that weekend. Then it occurred to me and I had to share with my doctor. At the casino, we encountered a rugby team, and one of the players and I got drunk and sneaked off together. The way my face fell when I realized. I could see she was trying not to react. Story 24. I was heavily pregnant and decided to do the birth shave. I had really bad hemorrhoids at the time and accidentally cut myself, causing the hemorrhoid to bleed profusely. I had to embarrassingly explain that I was bleeding from my rectum while trying to shave. I have never gone near a razor again. Story 25. I needed a hysterectomy, and I told 3 doctors that I wanted to perform the procedure myself. I showed up at the hospital with a surgeon's blade and put it to my abdomen, almost cutting myself open. A security guard tackled me, and I spent 3 days in the psychiatric ward. I told the doctor about my issues, and she ordered numerous tests. 1 month later, I had my hysterectomy. I was diagnosed with uterine cancer while I was in the mental ward. Story 26. I attempted suicide and was hospitalized. My case was presented in a room with many doctors and medical students. One of the professors asked me if I binge eat, and it was embarrassing to admit that. Story 27. In the early 1980s, Monday of the last week of school was senior skip day. Every senior skipped school except for those with too many unexcused absences. I had 9 absences, so I decided to skip. On Wednesday, I was called into the school office and told I wouldn't graduate because of too many absences. Turns out I had been late and absent from 2 classes, resulting in 11 days absent overall. Because of these 2 classes, I would have to repeat a course before I could receive my diploma. Here comes the question. I went to my doctor without an appointment, waited in line, and spoke with the physician assistant since she wouldn't answer her questions about my situation. I needed to see my doctor. When my doctor came in, I explained everything. The senior skip day, too many absences, and that I needed a doctor's note to excuse my tardiness. He stared at me for a moment, smiled, then called the physician assistant and instructed her to get me a doctor's note stating that I was under his care that day. He told me that the next time he saw me, it better be for something serious. I hope his retirement treats him well. Story 28. I gave myself a concussion by slipping and hitting my nose on my boyfriend's chin. Urgent care sent me to the emergency room to get a scan to check on my nose. The paperwork mentioned life-threatening. At least 7 different nurses and doctors in the emergency room asked me the screening questions. They didn't stop until I started listing all my other accidents that mostly happened when my boyfriend wasn't even in the same state, including how I will randomly lose my balance while standing still and just fall for no reason. I never got the scan, by the way. Story 29. The reason I was visiting was to get a 2-inch wooden splinter removed. It was red and swollen because I had spent much of the previous hour bent over a table while my mother and a couple of older female family friends tried to get it out. We didn't know quite how long it was until it was removed. Story 30. I once needed antibiotics for a urinary tract infection in my large breed dog. She was extremely aggressive and has since passed away. Our house was very secure, and we never had any incidents. I could not bring her to the veterinarian or even allow a veterinarian to come to my house for a physical examination. I read online that dog urine is similar to human urine, so I brought her urine sample to my doctor and claimed it was mine. He subtly accused me of being promiscuous, but I did obtain the antibiotics. Story 31. I went to the hospital with appendicitis. During the exam, I don't remember why, but they asked me to move to another room. So I did, trying to hold the gown shut. The doctor asked me if I was sexually active. I was 18 and got offended, asking him why that was any of his business. He explained it wasn't unless I noticed the pain more during sex. It was funny seeing 2 hickeys on my butt. I admitted those were hickeys and that I decided to go to the hospital because I thought I was going to die during sex. He said that confirmed it was my appendix. Story 32. It's not as embarrassing as some of these, but I pulled my hamstring and had to admit that I was doing the kid in play at my birthday party and jumped into the splits at age 38. Story 33. The daily vomiting I was experiencing turned out to be due to self-induced stress, not an illness. After I figured it out, I had to tell the doctor that it was all in my head and that anti-nausea medication would not help stop it. It was extremely embarrassing. Story 34. I believe I have attention deficit hyperactivity disorder. I am in my mid-30s and I think I have had it my whole life. However, it has been getting worse, and I was falling behind at work and missing deadlines. I would sit and stare at my work for hours. I could force myself to sit there, but I just couldn't complete the tasks. It was torturous. Everything else was piling up, and I was stressed out of my mind about everything. I had a breakdown in the doctor's office, admitting that I just couldn't function on some level. Apparently, medications for attention deficit hyperactivity disorder do not mix well with blood pressure medications, so she wouldn't prescribe anything. Instead, she gave me a referral to a psychologist. That was about 6 months ago. I'll let you know when I have time to follow up on that. Story 35. I told my doctor that I was frequently passing out when using the bathroom. Turns out I have endometriosis. I had to advocate for her to perform surgery to confirm the diagnosis, and she removed a significant amount of extra tissue. Since then, my condition has improved greatly. Story 36. I had a thrombosed hemorrhoid the size of a grape tomato. I had to explain the situation to 3 different doctors before one kind soul agreed to examine it and determine that it needed to be drained. Story 37. As a freshman in college in the early 1980s, I was naive and discovering relationships while learning more about myself. I panicked when I thought I had contracted a wart on my penis. With no real photos to compare to at the time and no internet access, I rushed to the school clinic. I met with an older doctor who had me unzip my pants and examine me at eye level while sitting on a rolling stool. He reassured me, saying, "You don't have warts. That's a scar from getting caught in your zipper." I realized I had been overly concerned. He then showed me a medical book with photographs, which was quite shocking. The appointment ended with him handing me a condom. I learned my lesson that day, although I did eventually have to return for treatment with a medicated shampoo. Story 38. I'm autistic with attention deficit hyperactivity disorder, but for the first 30 years of my life, I had no idea. I was diagnosed with obsessive-compulsive disorder, post-traumatic stress disorder, severe anxiety, and treatment-resistant major depressive disorder. I tried 13 different psychiatric medications and 6 therapy modalities over nearly 20 years of treatment, but I still wasn't a functional human being in any regard. At 33 years old, I had to tell a brand new family physician I'd never met that I was regularly going a week or more without showering and skipping meals because I just couldn't make myself get up and do anything. Despite all the effort I could muster from my exhausted mind, I could not take care of the most basic of my needs. I felt utterly disgusting and so ashamed of myself that I had to look at the ground while I admitted it. I couldn't look anywhere near the doctor's face even as he comforted me, thanked me for my honesty, and explained that this issue is actually extremely common in people with mental illnesses and those who are neurodivergent and don't have access to proper support. It turns out that growing up with multiple disabilities without knowing it, while holding myself to standards I couldn't possibly meet even on my best days, doesn't positively impact one's mental health. I'm doing better these days now that I'm properly diagnosed and treated, thank goodness. But I've learned that hygiene issues in particular are much more common than most of us know or acknowledge. Story 39. I had to admit I was pretty sure I had a tampon in when I had sex while blackout drunk. I was also concerned that the tampon was stuck inside me. Story 40. I am seeking estrogen cream to soothe and assist with my atrophied vagina. The doctor, who was young, had to look up why women need it while I was in the room, leading to many awkward questions. Story 41. As a doctor, I've heard many of these things more than once. I promise it's okay. We aren't going to judge you, and we've almost certainly heard it before. And if we haven't, we will probably tell you we did. The important message is that if you're using illicit drugs or prescriptions that aren't yours, please inform the medical staff. We are not law enforcement, and we want to treat you. If, for example, you use cocaine and don't tell us, we could administer something that interacts fatally. Please be honest. Story 42. I was sexually abused at 13, and I needed help for the alcohol problem it created. Story 43. When I was a child, I accidentally created a vacuum in a glass bottle and got stuck. Somehow I managed to free myself, but my lip looked as if I had received Botox. I was very embarrassed and told my grandparents that I had been stung by a bee. We went to the doctor, where the truth was revealed. Story 44. I suffered from itchiness in my anal area and thought it was something I was doing wrong. I was so embarrassed that I put up with it for years. I tried treatments for pinworms and yeast infections, but nothing worked. Eventually, I went to the doctor and told them I had chronic itchiness in my anal area. Turns out I have something called lichen sclerosus, which is treatable with steroid cream. Looking back, there's no reason to be embarrassed. Doctors examine all kinds of conditions regularly. However, I had to summon a lot of courage to discuss it with a medical professional and endured unnecessary discomfort for a long time. I don't enjoy discussing my condition, but if sharing my experience helps someone else, it will be worth it. Story 45. I went in for a checkup. The doctor said my heart rate is very fast and asked if I was nervous. I looked him in the eyes and told him I was on white. Story 46. I had no idea that I had a tampon inside me for 10 days, and I had to tell the doctor I was there because it smelled like a dead animal was trapped in my vagina. Story 47. I called Planned Parenthood at 20 and told the woman on the phone, I'm bleeding, and it isn't my period. She tried her best to hold back her laughter, and because of my voice, she insisted that my parent be there. Story 48. Blood and stool for a while. One doctor said, some people have bloody noses. Some people have bloody conditions. I was shocked by how unprofessional his response was after I gathered the courage to discuss this and make the appointment. I had to go through the process again with a different doctor, who diagnosed me with a severe case of hemorrhoids. Story 49. My 6-year-old son developed a urinary tract infection and a skin infection because he stuffed his foreskin with Play-Doh. I had to explain how this happened to deflect any suspicion of neglect or abuse, and I received a long lecture about how to care for intact boys, as I was circumcised as an infant to prevent this from happening again. Story 50. I had a rare hip dysplasia from birth, but I wasn't diagnosed until my 20s. It has taken about 9 years and 4 major surgeries to address 25 years of neglect and misdiagnosis. That's not the embarrassing part. Now, in my 30s, I recently had to explain to a new general practitioner that this severely neglected carpal tunnel is not from an office job. It's from using masturbation as a natural pain reliever for the 15 or so years prior to receiving proper treatment for what was ever-advancing arthritis of the hips. For a moment, I thought I was just a rare, compulsive female pervert. Story 51. I'm a married man, and my new doctor, as part of the new patient physical, asked, "How many sexual partners have you had in the last 12 months?" She was an older woman. My wife and I have an open relationship, and that year had been quite active. It is not something we hide, but this new doctor gave off a strict vibe, and it suddenly made me feel embarrassed to tell her how many people I had been with recently. I said it quietly, and she asked me to speak up. When I did, she raised an eyebrow and matter-of-factly said, "Okay, we'll be doing a sexually transmitted infection panel at every checkup." I just quietly nodded my head as if I had been given extra homework. Story 52. Not exactly the prompt, but I know several doctors who have told me that it's not uncommon for people, often older men, to come in and say they slipped and fell onto phallic objects like a shampoo bottle or a dildo. They maintain that they weren't just experimenting with anal activities for fun. They simply fell, completely naked, onto their wife's dildo, and it went right in with no chance of coming back out. Story 53. I had a piece of sore skin in an awkward private area. Every time I went to the bathroom, I was very uncomfortable. I was undergoing cancer treatment, and I knew that everything could be sensitive, so I wasn't surprised, but I was worried. It wasn't going away, and I knew I had to tell someone. The thing is, if I mentioned it, they would want to examine it. I remember sitting on the bed as the nurse filled out my intake form, and I blurted it out before I could stop myself. Sure enough, she had to take a look, and it was done in 2 seconds. A bit of sore skin in an uncomfortable spot. A few medicated wipes and a bit of paraffin to prevent irritation, and I was all set. Story 54. I went to my doctor for a very itchy rash. My lovely general practitioner said it looked like scabies. It turns out my severely alcoholic ex-partner had brought a homeless girl into our home while watching our child. I didn't realize how bad his condition had become, and he didn't take care of our child again until he had been sober for almost a year and a half. He went untreated for scabies for that entire time. That's how horrible and damaging alcoholism can be. I am very grateful that he did get sober and is now a great father. Story 55. I had to inform my urologist that I was interested in water sports to ensure it was still safe to participate in. It was really uncomfortable. Story 56. The first time I got COVID, it caused ulcers in my vagina. I received my first vaccine dose at the Centers for Disease Control and Prevention campus. For research purposes, they asked me if I had ever had COVID before and what my symptoms were. I responded, "I got ulcers." They then asked, "Where?" I replied, "In my vagina." They immediately typed it into the database. Story 57. As a doctor reading this, I must say that none of this is unfamiliar to me. I don't mean to downplay the feelings experienced by everyone, but I want to emphasize that you should never be ashamed to tell us what's going on. Time is wasted when people share vague stories or outright lies to avoid discussing something embarrassing. I don't care if you use drugs. I'm not here to penalize you or get you in trouble. I just need to know for your safety. If you place something in your body that's now stuck, we can address it more quickly if you tell me directly instead of beating around the bush and saying your stomach hurts. If a doctor has laughed or made you feel ashamed for sharing something like this, then that reflects poorly on their professionalism. Story 58. That I was indeed sexually active. This may not seem significant, but I come from a very religious family with a doctor who shares the same faith. Story 59. It's worse than you think. I was in so much pain I slowly walked from the opposite side of my math room to the door, all while my teacher yelled at me. He kept asking me questions, which I wasn't answering after my first question. "Something's seriously wrong. Can I please go see the nurse?" He told me I better not walk out that door or he would break my nose. I gave him the finger and took 10 seconds to close the door. I called my mom, who is a nurse, and told her, "I'm pretty sure I have testicular cancer," and she laughed. 2 hours later, a very attractive nurse, who was only a few years older than me, told me, "I'm going to examine your testicles. Do you want your mom to stay? Mom, please leave. Asterisk testicular torsion." Story 60. In recovery. Being honest with my doctor about how much I had drank over the years did not make me feel good. Story 61. I had to inform a doctor at the state health department that postpartum psychosis runs in the family. I explained that if I were denied a copper intrauterine device and became pregnant, the responsibility for the outcome would be on their hands. This came after she denied me birth control because I had never had children at 19 and might want them in the future. Once she heard the phrase blood on her hands, the pen hit the paper swiftly. Story 62. Being too rough with a sex toy can cause permanent hemorrhoids. The doctor's response was that she did her residency in Las Vegas and had already seen everything, which made me feel better. Story 63. I told her I was drinking 3 drinks a day. Later, I admitted I had lied. She mentioned they usually triple it, and I agreed that was about right. Story 64. I walked in with a 14-inch combat knife and told my doctor that if I didn't get help, I would harm myself. I have untreated emotional, unstable personality disorder and desperately need therapy. Story 65. I'm somewhat adventurous, but I prioritize responsibility, so I visited our city's public health department for sexually transmitted infection testing. While asking me some sexual health questions, one was, "How many sexual partners have you had recently?" I inquired, "What time frame are you referring to?" She replied, "Let's say 6 months." My eyes widened, and she could see my expression change as I tried to estimate. She said, "We'll just leave that one blank." My silence was quite embarrassing. I often wonder if she would have guessed more or less than the 30 individuals it actually was. Story 66. I had to tell them my father got me pregnant for them to let me use my false identification and get an abortion. I'm forever grateful they listened and turned a blind eye. Story 67. Due to my hydrophobia, I struggle to wash more than once a week. I understand that it may be unpleasant to hear, but I do my best to compensate by wearing a linen-based layer, regularly changing it, and using dry wipes and fabric to maintain cleanliness. I know it may not be sufficient for social acceptance, but I am trying my best. Story 68. I was bitten by a spider on my chest while sleeping. The spot was the size of a quarter by the time I went to see the doctor. She found it amusing and prescribed me about 800 milligrams of antivenom medication. Not ideal. Story 69. I had internal hemorrhoids but didn't realize it. My discomfort was extreme, making it painful to walk, sit, or use the restroom. I finally went to the hospital because I convinced myself something serious was wrong. The doctor examined me and diagnosed me with hemorrhoids. I received a prescription for hemorrhoid ointment. Story 70. I had a bad fall while skateboarding down a hill, and now I have bruises all over my body that seem to increase every day. About 5 days later, I noticed that my private area turned purple. I thought I was fine, but a purple area down there seemed to warrant a trip to the clinic, right? The doctor said I was fine and that it was normal bruising but didn't even examine the area. When I mentioned it, she asked if I wanted her to look at it, and I thought, absolutely not, but shouldn't she? Story 71. I'm not dark by any means. I'm of Greek and Spanish descent, so I have some darker features, such as my labia and overall lips. They're longer and seriously look bruised. As a kid, I watched adult films and those women had bright pink features. Took me a while to realize it was because I'm not white. When I was 13, I went to my pediatrician crying that something was seriously wrong with me. In fact, there is nothing wrong with a darker colored vagina that doesn't hurt. Story 72. My urethra ruptured during intercourse, similar to bending a straw too much, causing a slit that prevents suction. Story 73. My dad fell very ill shortly after returning from Vietnam. His fiancée's father, my grandfather, was the only doctor in the small town we are from. He had to admit to my grandfather that he had been with prostitutes while he was overseas. Turned out he had malaria. Story 74. I finally mustered the courage at 38 and showed my doctor my condition. I have large cystic boils all over my groin, especially around my anal area. I have been dealing with this since I hit puberty. Fortunately, I have some medical background, so I was able to provide documented proof of different treatments I had tried for other conditions which were legitimate. When I showed this, it led directly to a prescription for a biologic treatment. It is yet to be determined if it will help. Story 75. Oh no, this is horrific. I can't believe I'm putting this out on the internet. Maybe it will help raise awareness of how serious food intolerances can be. That night, I realized I couldn't eat gluten anymore. I experienced severe stomach pains, nausea, and diarrhea. At one point, I didn't know which end to address first. I was in so much pain that I fainted while sitting on the toilet, fell off, hit my head on the edge of the bathtub, and ended up on the floor. My husband came into the bathroom to help me, which must have been quite a sight. Throughout the night and the following day, I continued to feel unwell because my body was desperately trying to eliminate gluten. I reached a point where I couldn't go to the bathroom anymore, but my body was still urging me to, and I began losing blood. This was what I explained to my general practitioner when I finally saw her, as I was becoming increasingly concerned about my condition. The embarrassing part was that she donned gloves and performed a rectal examination to check for any serious damage. Unfortunately, I was too late for the celiac blood test, as you need to be consuming gluten normally for about 6 to 8 weeks for an accurate result. So she simply advised me to avoid gluten at all costs. I haven't touched it since. Story 76. Not nearly as bad as some experiences. However, I had to go to the emergency room because I sliced my finger open on a can of pumpkin puree. I ended up with 4 stitches and, foolishly, told the nurse I was making a pumpkin pie when she asked what happened. Story 77. I was with my boyfriend when he accidentally hurt me. That's not the reason I ended up in the hospital, though. We foolishly started again, and I developed a urinary tract infection that traveled to my kidneys. I had to explain to the emergency room staff how I got the infection in the first place. Story 78. Thankfully, I didn't need treatment because everything came back negative. However, at 6 months pregnant, I had to ask my obstetrician-gynecologist to redo the standard sexually transmitted disease panel that is done when you first get pregnant. I had just discovered my husband was cheating on me and hadn't even bothered using protection. I was scared for my baby. Even though it wasn't me who should have felt embarrassed, I was so ashamed. Story 79. I was 19 when I got bronchitis and was prescribed antibiotics. I developed a yeast infection, and when I spoke with the nurse over the phone, she suggested using Monistat. I obtained what I needed and took care of the situation. 2 hours later, I was writhing in agony. My mom took me to the emergency room, and the most compassionate doctor I have ever seen came in to treat me. My poor mom was embarrassed for me. I had to explain that my vulva had swollen to the size of an orange and felt like it was on fire. After providing some comforting words, he began the examination. As soon as he moved the drape aside, he exclaimed, "Oh, no! This is not something one ever wants to hear during an examination. I now have to list miconazole as one of my allergies." I have received some strange looks when mentioning that, but only one person asked me how I came to discover it. Story 80. I had a nurse who had to redress a wound on my backside every week when I was a teenager. It was a great conversation starter, to be honest. Story 81. I ran into a door face first and had a heavy nosebleed. I not only had to explain that I am an absolute idiot, but also had to confirm multiple times that my boyfriend did not hit me. Story 82. I used to work in logistics at Target. One day, around 2012 or 2013, I was back stocking toys in the storage room when I bent down to pick up a case for the stock shelves. As I started to stand back up with the box, I felt a sharp pinch in the lower part of my spine, causing debilitating pain for a few seconds. My team members saw the whole incident and filled out a report, sending me to the doctor for a checkup, just in case. By the time I arrived at the doctor's office, I felt fine, but they ran some tests and performed an examination. They put me on a week of light duty to avoid aggravating any potential issues. Now, for the embarrassing part, what was in the box that caused all of this? A piece of furniture? Dumbbells? No, it was a case full of Barbies, just the actual dolls, not playsets. I have never felt more emasculated in my life. Story 83. In Canada, we no longer conduct preventive checks. For example, men are encouraged to begin prostate and colon exams starting in their 30s, but we lack the resources to provide these. I fabricated symptoms of anal bleeding to receive a colonoscopy at age 35. Story 84. The doctor at Planned Parenthood asked me many questions when I went to get tested. The most embarrassing one made me feel as if she was profiling me. My boyfriend and I went in together but were seen separately. She asked me about 100 questions regarding my sex life, lifestyle, and living arrangements. The one that baffled me was when she asked if my partner uses meth. She didn't ask if I used meth, and I find it embarrassing to mention that my partner was heavily involved in that lifestyle. I am not part of it, but I felt like she could sense something. I'm not sure how that relates to an appointment at Planned Parenthood, but the good thing is that I'm no longer involved in that attitude. At least I've moved on. Is anyone single? Story 85. I had a partial hymen that wouldn't break, and many doctors looked at it and told me not to worry about it. However, I wanted it gone because it interfered with my sex life. Finally, I went to another obstetrician-gynecologist, and she removed it in her office. The procedure took less than 10 minutes and was painless. Now, I am very unbothered by pap tests after being examined so many times. Story 86. My green stool was due to drinking 3 Shamrock shakes daily for the past week. He was checking my prostate. Story 87. I received my diagnosis of postural orthostatic tachycardia syndrome after explaining to a cardiologist that I had been sexually choked to the point of losing consciousness, which felt similar to the episodes of dizziness I experienced daily. I woke up during an intimate moment apologizing because I thought I had just experienced a brief dizzy spell. The doctor immediately understood the situation and was pleased with my ability to articulate the issue. Story 88. I was diagnosed with prostatitis, and during the examination, the doctor, a very attractive woman in her early 30s, noted some inflammation. She then asked some direct questions, which led me to awkwardly admit that I enjoyed anal play with larger toys and occasional pegging. Story 89. I had to admit that I had been promiscuous and sleeping with multiple partners for about 3 years. One day, I received a message from one of them saying she tested positive for chlamydia and that I should get checked as well. The nurse and the doctor awkwardly informed me that I needed a single, clean partner. At the time, I was 24 and had known those two for a few years, so it felt more personal. Story 90. When I was 10, I applied hair removal cream on my arms, thinking it was regular cream. The caregiver who was looking after me rushed me to the doctor, believing I had measles. Story 91. I think I may have developed a throat infection, and I'm concerned that it could be a sexually transmitted disease. Story 92. Not the doctor, but the nurse. Way back in my youth, I caught a case of gonorrhea. The doctor said the nurse would be in to give me a shot of penicillin. The nurse was a girl I had gone to school with. Sigh. Story 93. When I was young, I had a blood test. It was the first one I remembered. My mother said the doctors needed to take my blood, and I was nervous. When the doctor came to take my blood, I screamed and was afraid. Eventually, my mother got me to calm down and they took my blood. Afterward, my mother took me to get some food as a treat. As I sat in the car, I was quiet. I then asked my mother, "Am I going to die?" She asked what I meant, so I repeated the question. She pulled over and asked why I thought I was going to die. I said, "They took my blood," not realizing that it was not all of it. My mother thought about it and understood why I was afraid in that chair. I thought they were taking all my blood and that I was going to die. Story 94. I suddenly experienced an inability to orgasm, with no changes to my lifestyle or medication. After a few very frustrating weeks, I decided to visit my gynecologist out of concern. It turned out that the kidney stone I thought I had been ignoring was actually an ovarian torsion caused by a sizable cyst. I lost the entire ovary, and now my hormones are all disrupted, which makes me feel cold and emotionally sensitive. However, at least I can enjoy intimacy again. Story 95. Bladder issues can be a sensitive topic, but we shouldn't feel embarrassed about conditions beyond our control. Interstitial cystitis issues are often the subject of jokes, yet they are an important health concern. Story 96. I told a doctor I was very depressed and felt like harming myself for days, and he said it sounded like a menstrual problem. I ended up sharing my experience of being sexually abused as a child to make him pay attention to me. It was frustrating that he didn't listen to me initially. Story 97. I had to explain to my doctor that I had a small vibrating object lodged somewhere it definitely shouldn't have been. And yes, it was still going strong as if it had a mission. It was easily the most awkward moment of my life, but the doctor didn't even blink. He just nodded as if to say, Tuesday, huh. Story 98. I had a urinary tract infection and a yeast infection at the same time. I discovered that I had been wiping incorrectly all my life. I was wiping too hard, which left bits of toilet paper inside me. It was very embarrassing. Story 99. My uncle is known for his violent sneezes. He once knocked himself out sneezing at work in a prison. Cameras captured the incident. Nobody was near him. Explaining to the emergency room doctor that the prison guard covered in blood knocked himself out must have been amusing. He then had to explain the situation to his boss and the union representative. His wife was much less amused than they were about the phone call she received. Story 100. Years ago, I was hungry and reheated some steak and rice for breakfast. I tried to eat too fast, and a piece of the steak got lodged in my throat. I attempted to cough it up and even looked up how to perform the Heimlich maneuver on myself since I was home alone, but I could still feel it there. I could talk and breathe normally, but when I tried to drink water to get it down, I couldn't breathe for a moment and ended up spitting the water out. Finally, I went to the emergency room and told the lady at the desk that I thought I was choking. She corrected me, explaining that I was choking because all it would take is for the food to shift and I wouldn't be able to breathe. The doctor tried a few methods, such as having me do jumping jacks and land in a specific way, giving me some medication through my nose, and finally administering a shot in my hip that made me extremely nauseous. None of that worked, so I had to undergo an emergency endoscopy to have the steak removed. It was embarrassing to admit to several medical personnel what was happening, as I felt stupid. The doctor provided me with various statistics about choking, which didn't really make me feel any better. It's very scary to think about. Interestingly, the 4th of July is the most dangerous holiday for choking, followed by Thanksgiving, at least in the United States. I even have some intriguing photos of my esophagus and the steak lodged there. Take choking seriously, even if it's embarrassing. No one but those doctors, my boyfriend, and the internet knows about this experience. Story 101. I once fainted and called an ambulance, thinking I was dying. To be fair, I was losing consciousness and hearing voices, so I was quite scared. I was convinced that if I fell asleep, I would die. The emergency medical technicians laughed at me. The doctors and nursing staff were compassionate, but the ward nurses and the emergency medical technicians were rude. It was the most embarrassing experience of my life. Now I avoid hospitals and nurses in general. Story 102. I overdosed once on caffeine in college. I took a bunch of caffeine pills, chugged some energy drinks, and drank a lot of coffee because I had a paper to write. It was enjoyable for a while until it wasn't. My heart was racing, with many palpitations and chest pain. I started vomiting and couldn't catch my breath. I ended up calling my mom at around 2 a.m. to ask if she knew how to counteract the effects of caffeine and told her what I was experiencing. My dad took me to the hospital, where they hooked me up to an intravenous line of something. I don't remember what now. The doctor told me this wasn't an uncommon situation for them to see since it was a college town. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.